More than 500,000 Americans each year visit the emergency rooms for kidney stone issues. It is predicted that up to 10% of Americans will have a kidney stone at least once in their lives. The occurrence of kidney stones in the United States increased from 3.8% in the late 1970s to 8.8% in the late 2000s. And unfortunately, the numbers are on a steady incline. In 2013 and 2014, 10% of Americans were diagnosed with kidney stones. The risk of kidney stones is about 11% in men and 9% in women. A variety of diseases increase the risk for kidney stones, diseases like high blood pressure, diabetes, and obesity. Kidney stones are hard deposits of minerals and acid salts that stick together in concentrated urine. Urine has various waste dissolved in it. When there is too much waste in too little liquid, crystals begin to form. The crystals attract other elements and join together to form a solid that will get larger unless it is passed out of the body with the urine. Usually, these chemicals are eliminated in the urine by the body's master chemist, the kidney. In most people, having enough liquid washes them out, or other chemicals in urine stop a stone from forming. The stone-forming chemicals are calcium, oxalate, urate, cysteine, xanthine, and phosphate. After it is formed, the stone may stay in the kidney or travel down the urinary tract into the ureter. Occasionally, minuscule stones move out of the body in the urine without causing significant pain or discomfort. But stones that don't move may cause a buildup of urine in the kidney, ureter, the bladder, or urethra. This is what causes the pain. There are 4 main types of stones. Calcium oxalate, the most common type of kidney stone, which is created when calcium combines with oxalate in the urine. Inadequate calcium and fluid intake, as well as other conditions, may contribute to their formation. Uric acid, this is another common type of kidney stone. Foods such as organ meats and shellfish have high concentrations of a natural chemical compound known as purines. High purine intake leads to a higher production of monosodium urate, which, under the right conditions, may form stones in the kidneys. The formation of these types of stones tends to run in families. Struvite, these stones are less common and are caused by infections in the upper urinary tract. Cysteine, these stones are rare and are usually inherited. Anyone can get a kidney stone, but some people are more susceptible than others to have them. Men get kidney stones more often than women do. Kidney stones are also more common in non-Hispanic white people than in people of other ethnicities. You may also be more likely to have kidney stones if someone in your family has had kidney stones. You don't drink enough water. Eating too much fructose correlates with an increased risk of developing a kidney stone. You follow a diet high in protein, sodium, and/or sugar. You are overweight or obese. You have undergone gastric bypass surgery or another intestinal surgery. You have polycystic kidney disease or another cystic kidney disease. You have a medical condition that causes your urine to contain high levels of cysteine, oxalate, uric acid, or calcium. You have a medical issue that results in swelling or irritation in your bowel or your joints. You take certain medicines, such as diuretics, water pills, or calcium-based antacids. It is not the first time you have had kidney stones. Kidney stone symptoms. Some kidney stones are as small as a grain of sand. Others are as large as a pebble. A few are as large as a golf ball. As a general rule, the larger the stone, the more noticeable are the symptoms. Kidney stone symptoms could be one or more of the following: severe pain on either side of your lower back, pain while urinating, vague pain or stomach ache that doesn't go away, blood in the urine, nausea or vomiting, fever and chills, urine that smells bad or looks cloudy. The kidney stone begins to cause aches and pains when it gets irritated or blocked. This quickly escalates to extreme pain. The treatment for a kidney stone will vary based on the size of the stone, what it is made of, whether it is causing pain, and whether it is blocking your urinary tract. In order to answer these questions and determine the best course of treatment, your doctor may recommend you have a urine test, a blood test, an X-ray, and/or a CT scan. A CT scan can involve contrast dye. If you have ever experienced an issue with contrast dye, be sure to inform your doctor before you undergo a CT scan. If your test results show that your kidney stone is small, your doctor may prescribe pain medicine and advise you to drink plenty of fluids to help push the stone through your urinary tract. If your kidney stone is large, or if it is blocking your urinary tract, additional treatment may be necessary, such as shock wave lithotripsy. This treatment uses shock waves to break up kidney stones into small pieces. After the treatment, the small pieces of the kidney stone will pass through your urinary tract and out of your body with your urine. This treatment usually takes 4 to 5 minutes to an hour and may be done under general anesthesia, which means you will be in a medically induced coma with a loss of protective reflexes. Another treatment option is Euroscopy. This treatment is also administered under general anesthesia. The doctor uses a long tool shaped like a tube to find and remove the stone or to find and break the stone into small pieces. If the stone is small, the doctor may be able to remove it. If it is large, it may need to be broken into pieces. In this case, a laser will be used to break the stone into pieces that are then small enough to pass through your urinary tract. In rare cases, a surgery called Percutaneous Nephrolithotomy is needed to remove kidney stones. During the surgery, a tube will be inserted directly into your kidney to remove the stone. You will need to be in the hospital for 2 to 3 days after the surgery to recover from this treatment. Consult your doctor as soon as possible. You may be asked to drink extra fluid in an attempt to flush out the stone out in the urine. If you strain your urine and can save a piece of the stone that has passed, bring it to your doctor. Or the stone may need to be removed with surgery. Drinking enough liquids will help keep your urine less concentrated with waste products. Darker urine is more concentrated, so your urine should always look very light yellow to clear if you are well hydrated. Most of the fluid you drink should be water. Most people should drink more than 12 glasses of water a day. Consult with a healthcare professional about the right amount of water that's best for you because everyone's intake is different based on height, weight, and gender. Water is better than soda, sports drinks, or coffee or tea. If you exercise during the spring and summer, your body will need more water than you do in the winter and fall. Therefore, you should dramatically increase your water intake on hotter days. Sugar and high fructose corn syrup should be limited to small quantities. Eating more fruits and vegetables will make your urine less acidic. When your urine is less acidic, stones may be harder to form. Animal protein produces urine that has more acid, which can then increase your risk for kidney stones. Also, try to reduce excess salt in your diet. Foods high in salt aids in kidney stone production especially. Foods like salty potato chips and French fries, deli meats, canned soups, prepackaged meals, and even sports drinks. These types of foods should rarely be eaten. You also want to try to maintain a normal weight, but if you are overweight, weight loss could help prevent kidney stones. However, avoiding high-protein weight loss diets like keto, because eating large amounts of animal-based protein, as well as crash diets can increase the risk of stone formation. You need adequate protein, but it needs to be part of a balanced diet. Seek guidance from a registered dietitian when embarking on a weight loss diet or any dietary interventions to reduce the risk of kidney stones. Also, don't be confused about having a calcium stone. Dairy products have calcium, but they actually help prevent stones because calcium binds with oxalate before it gets into the kidneys. People with the lowest dietary calcium intake have an increased risk of kidney stones. Some herbal substances are promoted as helping prevent stones, but there is insufficient medical data to support the use of any herb or supplement in preventing stones. See your doctor and/or a registered dietitian about making diet changes if you have had a stone or think you could be at increased risk for getting a kidney stone. To guide you, they need to know your medical history and the food you eat. Here are some questions you might ask. What food may cause a kidney stone? Should I take vitamin and mineral supplements? What beverages are good choices for me?
Like, comment, subscribe.